Hi, so today we're going to be initiating a blood transfusion. A couple things. We want to make sure that at the point that we're ready to infuse the blood, that we want to make sure that the physician has gotten informed consent. I'll go straight down to the blood bank. I'll gather all my supplies. We don't want this blood to be sitting out for hours. Before I do anything, I'm going to ask another nurse, hey, can you come in, double check all the information with me? She's going to tell me yes. She will be checking off. We do have our Y tubing here. We have our saline, because we're going to be connecting this normal saline to the pole and to the Y tubing. This is used to flush the line. We're going to have our packed red blood cells, which we will be verifying in a minute. We have alcohol to make sure that the port is cleaned, and the supplies for starting an IV, if it hasn't already been started, we're going to make sure that we put this IV line into a different IV site that's not being used for medications, because we want to be able to administer a medication, a life-saving medication, if need be, if this patient does have a reaction, and stop this IV site with the blood going. Okay, so I've double-checked that the informed consent has been signed. The physician has gotten that. Then I come in, I'm gonna explain who I am, what's going on to the patient. Hi, my name is Tyler. You have an order for packed red blood cells. The physician Smith put in, basically I'm gonna have another nurse come in. She's gonna double check all of the stuff with me. We're gonna make sure that we can avoid any issues if possible. The patient's gonna say yes. I'm gonna gather my baseline vital signs. I'm gonna get their heart rate, basically all the baseline vital signs, so that we do have a baseline. If anything goes wrong, we can spot tachycardia, we can spot crackles, we can spot, anything that we need to. I'm gonna go ahead, I'm gonna make sure I have my IV pole ready. I'm gonna have my gloves, I'm gonna have everything. The second nurse is gonna come in. We're gonna look at the bag. This is a fresh bag. We've gotten it from the blood bank within 30 minutes, We're gonna double check the name, we're gonna double check the blood type. If there's any kind of discrepancy, any spelling error in the name, any kind of plus sign that shouldn't be there, anything, the date on the bag, the expiration on the bag, we're gonna triple check this together. That way, if I miss anything, she's there. If she misses anything, I'm here. I'm gonna double check the patient's ID band. Make sure everything matches up, because we do not want to infuse the wrong blood into this patient. The blood is ready. I'm just gonna go ahead and prep the blood up here. Prep the saline up here. I'm going to wash my hands, let the patient know what's happening. Now I'm gonna put on my gloves. We're gonna open our package. All the things that I'm doing so that the patient feels informed, at least, and safe. I am going to tell them, if you report or if you feel any kind of flushing, dizziness, shortness of breath, pain, muscle pain, back pain, any kind of pain, any kind of itching, any difference, let me know immediately, okay? I am going to stay with you. I'm going to stay with you for the first 15 minutes. We're going to start it at a really low rate, less than 50 mLs an hour, because if this is the wrong blood for whatever reason, if the blood bank messed up, whatever, then we want to make sure that we haven't infused a mass amount of blood into the patient. We minimize the reaction, all that good stuff. So physician's orders have been checked, patient's been verified, supplies are gathered, patient knows what's going on, informed consent is in the computer, all that good stuff. We've hung our stuff on the IV pole, opened the IV tubing, I've washed my hands, I'm putting on my gloves now. Okay, patient has another IV site separate from where the medication's going. The integrity of the IV site is good. It's flushing. We have baseline vitals. These are all good things, okay? These are all things we need. I'm going to take out my Y tubing. This is the line that's actually going to connect to the patient's catheter site. We want to make sure that this stays clean, even though it has a cap on it. We just want to make sure it's clean. I'm going to go through, I'm going to check the integrity of the tubing. I'm going to close all the clamps, okay, because we want to have control over that. Coming up here, one of my bag spikes is missing a cap. We're just going to say that that was on there. Sorry about that. Everything looks good, okay? So all the clamp sites are closed. Roller clamp closed, roller clamp closed. Okay. So integrity of the saline's good. Integrity of the blood looks good. Integrity of the tubing is good. We're gonna go ahead, we're gonna spike the normal saline, okay? We're not gonna touch this cap. We're gonna spike saline first. Okay, saline's been spiked. I'm going to spike the blood next. Do not touch this cap. Spike the blood. Okay, so both of those are spiked. I'm gonna, since these are both closed, I'm just gonna go ahead and open the saline. I'm just gonna prime the tubing, okay? Make sure that there's no air bubbles or anything. We can go ahead and connect this to the patient, okay? Don't touch this. Clean it with alcohol, clean the patient's IV cath with alcohol. So now that we've got it all hooked up, we've got our baseline vitals, we've got everything, I'm going to set it at a very, very low rate. Once again, I'm gonna flush the line, turn off the saline, clamp the saline again, and then we can start the blood. It's gonna be at a really, really slow rate, less than 50 mLs an hour. I'm gonna be with the patient. I'm gonna be with the patient for at least the first 15 minutes. I'm going to have checked my vital signs before. I'm gonna check my vital signs during. I'm gonna check my vital signs after, okay? So if the first 15 minutes goes okay and the patient shows no signs of transfusion reaction, then we can go ahead and speed up the rate up to 120 mLs an hour, 125 mLs an hour. But basically, as long as this patient's doing good, everything seems to be running well, I can go ahead and document. The second nurse, the nurse and I will both put our initials that we checked it. We're gonna specify everything that was on the bag, the IV. We're just gonna go over all that. I'm gonna document which arm the IV site's in, how the patient's tolerating it, what rate I started at, all the baseline vitals, during vitals, after vitals. Make sure that this patient isn't having any kind of trouble. When I'm ready to leave the room, I'll go ahead, wash my hands, throw away my trash, and just make sure to document coming in often to check on the patient. If the patient does have a reaction, we're gonna stop it immediately. We're gonna stop the transfusion. We're gonna save the tubing. We're gonna call the physician immediately, okay? So we've double checked that the patient has a separate site to administer life-saving medications if need be. But in this case, Mr. Smith did not have a reaction. He tolerated it well. And that's it. Okay, thank you.